Nursing diagnosis: chest pain, decreased cardiac output, knowledge deficit, and anxiety, activity intolerance. You have to complete the whole formula for the nursing diagnosis. Complication regarding the MI: vascular complication, recurrent ischemia or infarction, especially if it's occur within the first 24 hours. It's very hard to diagnose marker not return to normal yet لأنها الكارديك انزيم لسه مش راجع للنورمال، فصعب انه نشخص السكند ام اي باول 24 ساعة، لكن نعتمد على الchest pain. Myocardial complication, also cardiogenic shock, which is loss of contractile force. Decreased cardiac strength severely result in severe heart failure. Mechanical complication like ventricular septal wall rupture, left wall rupture. Pericardial complication like pericarditis, pericardial membrane infection that may result in accumulation of the fluid as pericardial effusion. And this pericardial fluid that accumulate on the pericardial membrane may compress the heart and decreasing the cardiac output more and more. Thromboembolic complication: pulmonary embolism, deep vein thrombosis, systemic thrombosis. electrical complication وهي اللي بنخاف منها باول 24 ساعه: VTAC, VF, SVT, bradydysrhythmia and heart block. Management: as the therapy initiated quickly, the benefit the reperfusion will be great. As soon as we have to start the reperfusion، يعني قدر المستطاع لازم نبلش عملية التروية لعضلة القلب. Initial management: patient with suspected MI, aspirin as antiplatelet, serial ECGs, oxygen, nitroglycerine, vasodilator to decrease venous return so that decreasing demand, نعمل vasodilation in improving decreasing the afterload so that improving the perfusion to body parts. morphine as analgesic، وهي الخطوات بنختصرها بمونا: morphine, oxygen, nitroglycerine, aspirin. Beta blocker could be used to decrease the oxygen demand, decreasing the heart rate, blood pressure, and contractility, but we have to closely monitor the blood pressure. If there is a severe or there is a decrease in blood pressure, we have not to provide beta blocker, and we have to assess for other contraindications. Angiotensin converting enzyme inhibitor, ACE inhibitors, prevent ventricular dilation. It prevent the conversion of angiotensin 1 to angiotensin 2، والangiotensin 2 هو اللي بيعمل الventricular remodeling، and الangiotensin 2 هو اللي ممكن يزيد من الريسك للهارت فيلر والكارديوميوباثيز. There are different nursing responsibilities: check vital signs frequently, establish venous access, assess patient cardiac rhythm continuously, monitor for ST segment elevation and returning to the baseline, draw cardiac enzyme, hematology, chemistry, lipid profile, serial ECGs, cardiac enzyme, keep patient bed rest, obtain X-ray, echo, family and patient support. Fibrinolytic therapy is very important to establish reperfusion if there is no contraindication, if there are no contraindications. It lyses coronary thrombin by converting plasminogen to plasmin. Plasmin is responsible for dissolving the clot, degradation of fibrin. Fibrinolytic therapy given only in STEMI, ST elevation, not useful for patient without ST elevation. ST segment elevated in 2 or more leads. The goal to be given within 30 minutes. Can reduce the mortality if it's given within 0 to 4 hours. لكن according to the drug we can give it up to 12 hours after the symptom onset. وفي عندنا two protocol in the first 6 hours أو first 6 hour protocol and second 6 hour protocol. Patient should have at least 2 to 3 cannulas, one for fibrinolytic therapy and the other for the other drugs. Central line, it's better. Since the patient is at risk for recurrent thromboembolism, aspirin, heparin should be given. ويعتمد على نوع ثرومبولايتيك ثيرابي. مثلا الاس تي كي ما بنعطي ثرومبولايتيك، ما بنعطي هيبارين معه. الاكتيليز اللي هو التي بي اي بنعطي ثرومبولايتيك ثيرابي. صار في عندنا ادويه جديده غير الاس تي كي والاكتيليز، صار في عندنا الميتيليز اللي بنعطى اي في دايركت او اي في over 2 to 3 minutes. The patient should be monitored closely during and after infusion of fibrinolytic therapy. The nurse should assess the resolution of chest pain, the normalization of elevated ST segment, and the development of reperfusion dysrhythmias. وهي علامات استجابة المريض لهذا العلاج. إذا استجاب المريض الchest pain بيروح، الاس تي سيجمنت ممكن ترجع للنورمال او قريب من النورمال، وظهور علامات الريبرفيوجن انجري، في شيء مسكر فجأة انت فتحت البلد فلو وازلت التسكين امام البلد فلو. البلد فلو may injure some cells in the intima layer causing elevation of cardiac enzyme and some types of dysrhythmia like BVCs, VTAC او AV block. ممكن يصير في allergic reaction، ممكن يصير sensitivity وخصوصا بالاس تي كي، ممكن يصير في bleeding، ممكن يصير في hypotension،